Okay, episode number 2. Thank you so much, everyone. We have Dr. K, our expert dermatologist, and we're talking about your skin health and reproduction for the summer. And last time we talked about PCOS and acne, and we had a lot of great questions about how to treat it and all that stuff. So today we're going to talk about something else that happens in women with PCOS, which is extra hair, right? Hair here, they have to plug it, and here between the breasts. So that's a big problem for women who have PCOS and is related to reproduction as well. So Dr. K, thank you so much for coming again.
Thank you. So we have a special term to define this excessive hair, and it's called hirsutism. But I know you are originally from what country? Lebanon. So I want you to talk a little bit about ethnicity and extra hair. Do you see ethnically more hair in females, in Asian women? How that is connected with hirsutism?
Yeah, I think you know the way we learned it is that like Middle Eastern women and Indian, Pakistani, they tend to have more hair on the arm. And here on the thing,
Sides.
But not really in the middle.
Yes.
In women with PCOS, we see it more in the middle, right? Mm-hmm. Like we call it midline hirsutism, and that's not usual, regardless of the ethnicity, right?
I see. That's important.
That's right. So tell us a little bit. If I have a woman with PCOS, Dr. K, and she goes to you, how do you know if it's normal or abnormal, her hair?
That's exactly what are you explaining. So the distribution of hair, more midline, and the number. So first of all, I ask about family. If family members had the same amount of hair, or that's a little bit abnormal when hair started, and then I examine a patient, and then I look for other signs such as thinner hair on the scalp, or presence of acne, or presence of obesity, stretch marks, darkening on the neck. We call it acanthosis nigricans. So all other signs that can lead to PCOS. And is excessive hair a sign of high testosterone or not?
The reality, it's not just high testosterone. So testosterone is a hormone that comes from the ovaries. So you can either have more production, or the body feels it more, but it's normal level.
I see.
So it's really about the receptor. So you can have extra hair, the way I see it, in women with PCOS. Your testosterone level could be normal, but you can have extra hair. Why? Because your body is more sensitive to this level.
I see.
So
and again, because of that, probably reproductive function can vary, right?
Absolutely. So that we don't like, too much testosterone is not good for the development of the egg, right? The egg wants a small balance between testosterone and estrogen, right? And the reason why men have hair and women don't on their face is because we both have estrogen and testosterone, but women have more testosterone than estrogen ratio, and we have the opposite, right? So in women with PCOS, this ratio a little bit can vary and can disturb the egg quality and ovulation, leading to infertility.
Yeah, that's very interesting. So
tell us, if I send you a patient and has extra hair, and she says, okay, Dr. K, I shave here, I have to plug every day. Tell us what's the treatment?
Well, yes, you can actually do waxing.
Besides laser, because I know laser works.
Laser works, but it's actually, we don't call it laser removal. We say hair reductions, because with the laser you actually don't reduce 100% of hair.
Okay.
It's still something.
Even if I do multiple sessions?
Yes, sometimes you cannot remove 100%.
Okay.
100% we are killing a hair follicle only with electrolysis, when we go with a little with a little needle and deliver electricity down.
And this is done?
And then it's done. Then the hair follicle is dead. But
so can you do this for a patient who wants to?
I personally don't do electrolysis because it's an old method, and but some spas in the city offer this. and it's pretty popular among some patients. And then we have a cream called Vanica or erflornithine, which can reduce the hair growth, but it will not completely reduce it.
So does the shift, how many times per day and for how long before a woman with PCOS sees a difference?
I think you need couple treatments. Each laser treatment, for example, will give you maybe 10 to 20% of reduction each treatment. So you need 5 to 6 treatments, and then I like to combine it with the cream because it makes it more effective and it prevents hair growth after you finish those treatments.
So basically, a combination of cream and laser seems to be good.
Seems to be a little
but let's
bit better.
say I'm someone who forgets to put cream every day.
Well, laser still will work. It's just you may still have a little regrow of hair even after you finish 5 to 6 treatment. It's not 100% effective. That's why we say reduction. But it may be enough to feel more comfortable, I would say.
So let's say I don't want to spend a lot of money, and my insurance covers for some pills that reduces my hair. Is there anything?
Oh yeah. Spironolactone in the long run.
So spironolactone, we talked about it for acne. So it's the same one.
It's the same one. Can work.
It looks like a magic pill.
It is. It's still I would not call it magic pill for hair reduction because it needs long time and pretty high dosages. I would say higher than in acne. So, but why not? It's cheap and convenient.
Okay, that's great. So is there any other treatments for extra hair in women with PCOS that can help them? So in summary, we have the cream, we have laser, and we have pills, right?
I think
sorry.
It may be in general if you are obese and you improve your lifestyle and your PCOS with natural remedies improves a little bit, I guess, you potentially may have a little bit of less hair, but it's hard to prove, I would say. What do you usually do in PCOS?
If someone has PCOS with extra hair, I send them to Dr. K. That's what I do.
Thank you.
Well, thank you so much for watching, and we'll see you next week.